All right, we're here live at HMPS 2026 in Salt Lake City, and I'm sitting down with my good friend Ben Texter from Digital Health Strategies. Great to see you. You and I have seen each other a couple of times now over the last couple of days.
Yes.
And it started off, actually the event started off talking about one of your surveys that you've recently done. But
Yes.
before we jump into that survey, which is really important, do you mind sharing a little bit about yourself with our audience?
Yeah, I'm Ben Texter, and I'm the CEO, or the co-CEO, I should clarify that, of Digital Health Strategies. And we are a firm that specializes in patient activation for high margin and high value use cases for health systems across cardiology, oncology, philanthropy, pharmacy. And what we do is we identify patients that are in need of treatment but are stuck in the system and activate them to complete care.
Important role. And one role that marketing typically, at least up to date, is not spending a lot of time on, except for the clients you work with, the organizations you work with. That's the focus of what your survey was about.
Yeah, and what was interesting about the survey, and was actually surprising to me, is that historically, how growth has been viewed, obviously marketing has played a role in driving growth for the organization, and historically it's been about new patient acquisition.
Yeah.
How do we get new movers that are moving to our community, steal from competitors, and what has been largely ignored is the fact that 55% of patients, once they get on the pathway to treatment, don't complete their care. And it's a big problem because it represents a huge missed growth opportunity that we've calculated through another research report that we're releasing next month that represents $1 billion in missed growth by not getting patients to complete the care around high margin or high value use cases. I think marketing has an enormous opportunity and role to play in this. Not just in the identification of patients within specialties and subspecialties that need care and are breaking down in the referral process or in the treatment or care pathway, but the role that they can really own and play in this is in the personalization and the communication to those patients during the treatment process. And they're really uniquely positioned to own this space because of their expertise in personalization and communication. And so I think there's an enormous opportunity moving forward for them to own what is the accountability gap. No one really owns this within the organizations, which is what the survey revealed. That most organizations don't know who owns this.
Or there are multiple
failure.
Owners and it's disparate.
Exactly.
Right? And the communications, I've been in health systems where the communications are really difficult, let's put it that way.
They are difficult. They are difficult. And I think what's interesting too is the human behavior element here. Most people assume that people aren't completing treatment because of access issues. And while writ large there are access issues, there's always pockets of access in an organization. And what's not being factored in is the human aspect of why people delay care. And there's 4 reasons why patients delay care behaviorally. The first is they don't understand the treatment option. So they don't understand that a TAVR procedure is not open heart surgery. The second reason is they're scared. They have unexpressed fears, and that information is completely invisible in the electronic health record. The fourth reason is we now have appointments that are 15 to 30 minutes long, and when you have a patient with multiple conditions, they may not get to your aortic stenosis or your AFib diagnosis in that encounter. And the fourth reason is financial reasons and insurance reasons. And these are all of the aspects that marketers are experts in understanding from a consumer perspective.
I mean, that's exactly where, and you think about marketing outside of healthcare, we always say, there's that adage of you're better at marketing to your existing patients to re-engage with your brand and re-engage with your care. Applying that to healthcare, makes such logical sense.
Yes, it does. I think what's also really interesting that the survey revealed was that only 1 in 49 of the 50 chief marketing officers that we surveyed, and these are chief marketing officers predominantly from health systems with $5 billion of revenue or above, spend more on patient activation than they spend on patient acquisition. If you look at financial services, Chris, their budget, on average, a financial services organization will spend 68% of their marketing budget on existing patient loyalty.
Wow.
I mean, existing customer loyalty.
Yeah.
And so it's an inverse. And so I think the opportunity is for marketing departments to start shifting their budget towards patient activation and start owning more of the loyalty mandate.
You know, I had the pleasure of participating in a panel discussion about the survey results with some leading marketers.
Yeah.
And one of the things they said is that marketing is sometimes not perceived as being in that role.
Yeah.
And so what's your perspective on that?
My perspective is that while there are consumer barriers are what's causing the delays in treatment and people not following through on their care plans, the missing piece within marketing departments is the depth of clinical understanding. To be able to come to the table with a cardiology team and say, we're going to focus on helping personalize messaging and persuade people to overcome these human barriers, you first have to understand the clinical reality. And with a condition like aortic stenosis, that means you have to understand what aortic stenosis is. You have to understand who qualifies for treatment for TAVR. Is it somebody with moderate aortic stenosis or severe aortic stenosis?
Right.
How do you align your care teams on creating a clarity on the clinical eligibility of those patients? Do you understand what an ejection fraction is? Do you understand what the severity of the disease means to the marketing campaign? So I think there's a dual mandate here. One is owning more of the consumer outreach to these clinically eligible patient populations, but then also developing a depth of clinical understanding to be able to speak authoritatively with your doctors and care teams.
You know, you position this as like a financial benefit to the organization. I think there's also a little bit more leaning into the mission of why we're here. I mean, we're here to help drive people to better care.
Oh
so
my gosh.
We're completing that as well. I mean, this kind of serves both purposes for us.
There's a huge mission impact.
Yeah.
We just had a program running for lung cancer screenings, and we saw a 24% increase year over year in the number of people who had an order for a lung cancer screening and then completed the screening. Of those patients, there was a subset. I think in just the month of March, there were 9 patients with pulmonary nodules that were identified.
Wow.
Those are patients whose lives, ostensibly, we're going to help save or improve. And the amazing thing about lung cancer screening right now is at a time when the screening rates are abysmally low, the survival rates are tremendously high. They're better than they've ever been. They're over 70%.
Oh, wow.
So right now you have this interesting moment where screening rates are really low, but survival rates are really high. And what needs to happen is marketing departments coming in and helping people pull through it, and not only can you have a financial benefit, but you can save people's lives in the process. It's incredibly powerful. It's a huge mission impact.
Yeah, absolutely. I think that makes sense. I want to highlight on one other thing from this survey that is near and dear to my heart. How you asked about the use of AI in this space, and I think that this is a really great table stakes opportunity for us.
It is.
Share a little bit about what your survey revealed.
Our survey revealed that most people are focused on using AI for content creation, and I think where it has an enormous or tremendous opportunity is actually in identifying quickly and accurately clinically eligible or qualifying patients for these treatments. If you have your data cleaned and you have the data right, I think applying AI to problematic data is only going to scale a problem and create safety and quality issues. Having said that, it has a tremendous opportunity to accelerate the identification of patients. At the same time, you need a human validation layer. I mean, at my company, we've spent 12 years building workflows and the processes and the QA to ensure that when AI is being leveraged, that there's also a human validation layer that's ensuring the quality of
Right.
that identification, and then also appropriately matching patients to the right segment and outreach strategies.
Yeah, well, it's tremendous work that what you're doing and helping
Thank you.
organizations to do that. This survey is important. We're going to make sure that people can access it when they watch this video. We'll link to it, and then the
Thank
additional
you.
survey that you're coming out with, or study that you're coming out with. Ben, thanks for spending a few minutes with me
Yes.
today and sharing those insights.
Thank you for having me. I really appreciate it.